Doctor, I want to know why you won't have a vaccine.
I've looked at the risk-benefit analysis like I do for all drugs that just come out on the market. So naturally, as soon as any drug or vaccine comes on the market, I will wait before I prescribe it or wait before I actually take it myself, just to see what sort of side effects come out. But also there are other issues, like for myself, I got COVID, I had some immunity, and also I had some other illnesses. So I might have some predisposing factor to be more likely to have a side effect, for example.
Our regular GP says you're being irresponsible by not having a vaccine. I'd like you to reply to that, please, if you would.
There are many irresponsible behaviours, but we don't criticise other people for. So, for example, the vascular surgery ward is full of people maybe who smoke, and we don't go about saying, oh, you're so irresponsible for smoking, or you're on the liver transplant ward and you have drunk alcohol. We don't not treat people because of the decisions that they have made. The issue is that the COVID crisis is petering out. I mean, we had good news yesterday that the cases are going down. And it looks like, coming towards March, Michael Gove said that we should learn to live with COVID.
If an 85-year-old patient of yours came to see you and as a result of you not having been vaccinated, they contracted COVID from you with whatever effects that might have, how would that make you feel?
They wouldn't necessarily have got it from me because I wouldn't necessarily be carrying COVID. You don't know what my antibodies are like. You don't know that I'm not protected from it.
You're less likely to carry COVID. It gives you some immunity if you have your vaccinations and your booster, unless you're flying in the face of everything else that we've been told.
No,
are you right and all the other doctors are wrong?
No, you are likely to be safer if you have the boosters and vaccinations. That's not the issue. The issue is that even if you do, you could still transmit the virus. And if that lady were to contracted it, not necessarily
so you reduce the odds. You reduce the odds.
You can reduce the odds, but the point is that I'm worried that people are going to lose their jobs and the NHS is going to really suffer.